Welcome to The Surgeons, brought to you by Hall & Rye Plastic Surgeons and hosted by Dr. Hall and Dr. Rye. Tonight's show features Dr. Brian Hansen, a live breast reduction surgery, as well as answers to your medical questions.
Welcome to The Surgeons. I'm Dr. Wesley Hall.
I'm Dr. Scott Rye.
And I would like to, before we do anything else, I want to apologize to everybody who we're going to offend during this show and all subsequent shows. That's coming directly from the legal department. So, and just getting that out of the way here now. We're apologizing for any offense we've given. We are surgeons and we have to do surgery sometime. And you have to go do surgery.
Saying that I'm going to miss Dr. Hansen's interview, I'm very sorry, but I'm off to surgery, and please don't offend anybody.
Go to surgery.
All right, thank you. All right, we'll see you later.
So we're with Dr. Brian Hansen, and we're having a good old time talking about all kinds of things here. I know we were talking about like your work with engineering and aerospace, and that's real fascinating. That's not why you're here today. You're here to talk about what you do with chiropractic. I want to get back to the aerospace stuff, though. That's kind of fun.
Sure.
Hearing about that. But tell us what you're doing now, because you got out of engineering. You said, I got tired of working in a cubicle for working on B-1 stealth bomber that you said, I'm going to have to kill you if you tell anything more about it. And I don't
So
want
we
you to
stopped
kill me.
talking.
Right. But so tell me what you're doing now.
So right now I own ProSpinal. We do non-surgical spinal decompression. We do class 4 deep tissue laser therapy, and we do chiropractic care. We treat a lot of athletes, regular weekend warriors, regular people that aren't athletes.
Well, I got to go back to the class 4 laser. What was this?
So it's a deep tissue laser. It's used on most professional athletes. It actually activates the mitochondria in a cell, upregulates nitrous oxide release, which creates vasodilation, as you know, reactive oxygen species for inflammation control. So these are ways to control pain and increase blood flow to tissue that's been damaged.
Now, what's a class 3 laser?
They're a little weaker. They're not as strong. Class 4s require eye protection. It's about a 980 nanometer photon load. Class 3s, 2s, and 1s don't require eye protection.
Well, I don't want to have to wear eye protection, so I'm going to close my eyes when you do this to me. I hope I'm not needing
No,
this
that's
stuff.
okay.
Okay. So how much of that is what you're doing versus, say, the traditional chiropractic stuff?
Our laser right now is probably our limiting factor in the practice. It's booked from 8 to 5.
Really?
We do it mostly on our decompression patients as a precursor, pre-treatment to decompression to activate the cells around the disc when we work on healing it. But we also do it on sprains and strains, plantar fasciitis, tendonitis, rotator cuff tears.
So this works everywhere?
It works on anything that ends in itis.
Yeah. Ooh, I got a lot of things that I don't want to talk about that end in itis today here. But okay, so you said you've got the traditional chiropractic. You're doing the class 4 laser. What was the other thing?
Decompression, non-surgical decompression.
What do
So
you do with
surgeons
that?
will do spinal decompression,
Okay,
right?
sure.
So we use a mechanical traction style device with load cells and feedback mechanisms with a person tied to a table laying flat. And as we pull apart at a certain belt angle, it creates a negative pressure in the disc. It sucks the herniation off of the nerve root, creating decompression. And then with the precursor of the laser, the fibers actually start to adhere and heal to themselves.
Okay, now I got to ask you, because obviously there's a lot of people having spinal surgery. Tell me about how your decompression results would compare with that. Say somebody who's having decompression
Honestly,
surgery.
hard to put them in the same boat. So according to the New England Journal, so this is not a made-up chiropractic statistic, a third don't change, a third get better, and a third do get better.
These are patients who have had
Epidurals, physical therapy, all the pain management, drug management, and finally they're tired of all that and they go for surgery.
Okay.
A third don't change, a third get worse, and a third get better. So 67% of the time, you're really not going to be any better off.
Right.
Ours, we do a 3-day no-risk trial in our program, so it's hard for me to say what the true outcome would be if I took people that didn't respond in the first few.
Yeah.
But after 3 visits, if you have some kind of appreciable result, you continue through about a 20-visit program, and our outcomes reported across the country somewhat before modifications to the table, because I made some.
Yeah.
86% for disc herniations and 90% for disc bulges.
So you made the modifications yourself to the table that you're working people on.
That's right.
Does this have anything to do with your engineering background? or-
Probably a bit. Yeah.
Okay, I'm guessing.
Yeah, so the deal was there were about 5 things that were complained about in a lot of the research that was done. And one of them was patient positioning and the fact that patients, if you don't tie them up tight enough or effectively, they slip and you don't get the full pull on the
Now,
back.
when you're tying up a patient, is this something that, you know, their parents know about? Or is it, that's a joke. I'm joking, of course.
Yeah, of course. No, the chains we always leave out.
Okay, good.
So it's a Velcro wrap around the waist. It's usually pretty comfortable. People sleep, play on their iPads for the 25-minute pull.
Oh, they're sitting there just playing on their
Yeah,
iPad.
you're just laying on a table and you're getting this. It feels amazing. Even if you don't have back pain or disc pain, it feels great to just
just
get
like
on there.
feels good.
You're countering gravity. Yeah, it's great. It doesn't hurt, and you'll pull someone half their body weight. So on a 200-pound person, it's 100 pounds on one disc.
Wow.
Versus like the
People
teeter
ever
over.
get taller when you do that?
We had one lady 3/4 of an inch, but she had
Get
a
outta
horrible
here.
scoliosis, and it straightened some of the curve
Get out of here.
Yeah.
Really?
She was 78.
Wow.
Yeah.
Oh, that's awesome.
It was a lot of fun.
Okay, so now I got to tell you that sometimes we'll see some patients who'll be coming in and they've got like a lot of neck pain, shoulder pain they've got macromastia. They've got like really big
Very
breasts.
large. Yeah.
And so we do surgery on that to help alleviate those symptoms. Do you ever have anything that helps those patients?
We work on patients that are big-breasted for sure, and you can, you just pick them. Upper back pain, neck pain, shoulder blade pain, collarbone pain, right? With the grooving of the bra strap.
Absolutely.
So yeah, we work on them, we document care well, and then we tell them with good care documentation, you can get it approved to get a reduction. Yeah, I would recommend that to large-breasted women.
But what do you do specifically for those patients as well? Because I know what we do. We're cutting out
Make
the
them smaller,
tissue.
sure.
Yeah, making them smaller. But
So we do joint manipulation. Yeah, we get the back moving better, so that chronic forward posture and
Yes.
that ligament strain and all the muscles that are fighting that weight get a break. We get the joints moving again. When joints move, they hurt less. It's not going to fix the problem, but it gets them moving better.
Yeah, but I'm just wondering if you could ever avoid surgery, if you've ever gotten anybody who said, oh, yeah, that's great, and I don't need the surgery. I mean, you were telling me about a gal you had that you said they're like,
She's a size G reportedly, and they're very large. She insists on even, feel the bra strap to feel how heavy they are. It's remarkable how heavy a single breast can be when it's that size. I've recommended surgery to her several times.
Yes.
She has neck pain, she has upper back pain, her posture's compromised, she can't see her feet, especially with neck pain, which exacerbates the neck pain.
it's a problem that a lot of women have. I think a lot of people don't understand this, but what I'm really pleased to hear about is you've got all these different modalities that you've got, not just for these patients, but sports patients, spinal patients. Thanks very much for coming in. We really appreciate it. It's
Thank you, Doc.
a pleasure.
You bet.
All right.
My pleasure.